Psychiatric Q and a Part 3. 61. The nurse is caring for a male client diagnosed with catatonic stupor. The client is lying on the bed with his body pulled into a fetal position. The appropriate nursing intervention is which of the following? A. Ask direct questions to encourage talking. B. Leave the client alone and intermittently check on him. C. Sit beside the client in silence, with occasional open-ended questions. D. Take the client into the day room with other clients so that they can help watch him. The answer is C. Sit beside the client in silence, with occasional open-ended questions. Clients who are withdrawn may be immobile and mute and may require consistent, repeated approaches. Communication with withdrawn clients requires much patience from the nurse. Interventions include the establishment of interpersonal contact. The nurse facilitates communication with the client by sitting in silence, asking open-ended questions, and pausing to provide opportunities for the client to respond. Test-taking strategy: eliminate option 2 because the client would not be left alone. Option 4 relies on other clients to care for this client, which is an inappropriate expectation. Asking direct questions of this client is not therapeutic. Option 3 provides for client supervision and communication as appropriate. Review care of the client with catatonic stupor if this question was difficult. 62. A nurse employed in a mental health unit of a hospital is the leader of a group psychotherapy session. The nurse's role in the termination stage of group development is to A. Encourage problem solving. B. Encourage accomplishment of the group's work. C. Acknowledge the contributions of each group member. D. Encourage members to become acquainted with one another. The answer is C. Acknowledge the contributions of each group member. In the termination stage, the group leader's task is to acknowledge the contributions of each member and the experience of the group as a whole. In this stage, the group members prepare for separation and assist each other to prepare for the future. Options 1 and 2 identify the tasks of the working stage. Option 4 identifies the orientation stage. Test-taking strategy: use the process of elimination. Eliminate options 1 and 2 first because they are comparative or alike. From the remaining options, note the relationship between the words termination stage in the question and option 3. Review the stages of group development if you had difficulty with this question. 63. Laboratory work is prescribed for a client who has been experiencing delusions. When the nurse approaches the client to obtain a specimen of the client's blood, the client begins to shout, "You're all vampires. Let me out of here." The appropriate nursing response is which of the following? A. What makes you think that I am a vampire? B. I'll leave and come back later for your blood. C. I am not going to hurt you, I am going to help you. D. It must be frightening to think that others want to hurt you. The answer is D. It must be frightening to think that others want to hurt you. Option 4 helps the client focus on the emotion underlying the delusion, but does not argue with it. Option 1 places the client in a position that requires a response. Option 2 avoids the client. Option 3 is an attempt to convince the client to believe another thought. This response may cause the client to hold the delusion more strongly. Test-taking strategy: use the process of elimination and therapeutic communication techniques to answer the question. Option 4 is the only option that recognizes the client's needs and focuses on the client's feelings. Review therapeutic communication techniques if you had difficulty with this question. 64. A male client with delirium becomes disoriented and confused in his room at night. The best initial nursing intervention is to A. Move the client next to the nurse's station. B. Use an indirect light source and turn off the television. C. Keep the television and a soft light on during the night. D. Play soft music during the night and maintain a well-lit room. The answer is B. Use an indirect light source and turn off the television. Provision of a consistent daily routine and a low-stimulating environment is important when the client is disorientated. Noise, including radio and television, may add to the confusion and disorientation. Moving the client next to the nurse's station is not the initial action. Test-taking strategy: use the process of elimination and note the strategic word initial in the question. Eliminate options 3 and 4 first because they are comparative or alike. Focusing on the strategic word will direct you easily to option 2. Review measures related to the client who is disoriented and confused if you had difficulty with this question. 65. A client begins to experience extrapyramidal side effects from an antipsychotic medication. The nurse anticipates that the physician will prescribe which of the following to treat this condition. A. Haloperidol, Haldol. B. Benztropine, Cogentin. C. Prochlorperazine, Compazine. D. Chlorpromazine, Thorazine. The answer is B. Benztropine, Cogentin. Benztropine, Cogentin, is an anticholinergic medication used to treat drug-induced extrapyramidal reactions, except tardive dyskinesia. Options 1, 3, and 4 are antipsychotic medications. Antipsychotic medications can cause extrapyramidal reactions. Test-taking strategy: focus on the medications in the options. Recalling the classifications of each will direct you to option 2. Remember that benztropine, Cogentin, is an anticholinergic medication. Review the side effects and extrapyramidal reactions of antipsychotic medications if you had difficulty with this question. 66. A client admitted to the mental health unit is experiencing disturbed thought processes and believes that the food is being poisoned. Which communication technique does the nurse plan to use to encourage the client to eat? A. Using open-ended questions and silence. B. Focusing on self-disclosure regarding food preferences. C. Identifying the reasons that the client may not want to eat. D. Offering opinions about the necessity of adequate nutrition. The answer is A. Using open-ended questions and silence. Open-ended questions and silence are strategies used to encourage clients to discuss their problems. Options 3 and 4 are not helpful to the client because they do not encourage the client to express feelings. The nurse should not offer opinions and should encourage the client to identify the reasons for the behavior. Option 2 is not a client-centered intervention. Test-taking strategy: use the process of elimination. Eliminate options 3 and 4 first because they do not support client expression of feelings. Eliminate option 2 next because it is not a client-centered response. Focusing on the client's feelings will direct you to option 1. Review therapeutic communication techniques if you had difficulty with this question. 67. The nurse is caring for a female client who was admitted to the mental health unit recently for anorexia nervosa. The nurse enters the client's room and notes that the client is engaged in rigorous push-ups. Which nursing action is appropriate? A. Interrupt the client and weigh her immediately. B. Interrupt the client and offer to take her for a walk. C. Allow the client to complete her exercise program. D. Tell the client that she is not allowed to exercise rigorously. The answer is B. Interrupt the client and offer to take her for a walk. Clients with anorexia nervosa frequently are preoccupied with rigorous exercise and push themselves beyond normal limits to work off caloric intake. The nurse must provide for appropriate exercise and place limits on rigorous activities. Options 1, 3, and 4 are inappropriate nursing actions. Test-taking strategy: use the process of elimination and focus on the client's diagnosis. Also, focus on the need for the nurse to set firm limits with clients who have this disorder. If you had difficulty with this question, review interventions for the client with anorexia nervosa. 68. The client with schizophrenia has been started on medication therapy with clozapine, Clozaril. The nurse assesses the results of which laboratory study to monitor for adverse effects from this medication? A. Platelet count. B. Blood glucose level. C. White blood cell count. D. Liver function studies. The answer is C. White blood cell count. The client taking clozapine, Clozaril, may experience agranulocytosis, which is monitored by reviewing the results of the white blood cell count. Treatment is interrupted if the white blood cell count drops below 3000/mm3. Agranulocytosis could be fatal if undetected and untreated. The other options are not related specifically to the use of this medication. Test-taking strategy: use the process of elimination. Recalling that this medication causes agranulocytosis will direct you to option 3. Review the adverse effects of this medication if you had difficulty with this question. 69. A client with an eating disorder is planning to attend group meetings with Overeaters Anonymous, and the nurse describes this group to the client. The nurse determines that the client needs additional information if the client states which of the following about this self-help group. A. The leader is a nurse or psychiatrist. B. The members provide support to each other. C. People who have a similar problem are able to help others. D. It is designed to serve people who have a common problem. The answer is A. The leader is a nurse or psychiatrist. The sponsor of a self-help group is an experienced member of the group. A nurse or psychiatrist may be asked by the group to serve as a resource, but would not be the leader of the group. Options 2, 3, and 4 are characteristics of a self-help group. Test-taking strategy: use the process of elimination and focus on the subject, self-help group. Note the strategic words needs additional information in the question. Note that options 2, 3, and 4 are comparative or alike. This should direct you easily to option 1, the correct option. Review the characteristics of a self-help group if you had difficulty with this question. 70. The home health nurse visits a client at home and determines that the client is dependent on drugs. Which of the following assessment questions would assist the nurse to provide appropriate nursing care? A. Why did you get started on these drugs? B. How much do you use and what effect does it have on you? C. How long did you think you could take these drugs without someone finding out? D. The nurse does not ask any questions for fear that the client is in denial and will throw the nurse out of the home. The answer is B. How much do you use and what effect does it have on you? Whenever the nurse carries out an assessment for a client who is dependent on drugs, it is best for the nurse to attempt to elicit information by being non-judgmental and direct. Option 1 is incorrect because it is judgmental and off-focus and reflects the nurse's bias. Option 3 is incorrect because it is judgmental, insensitive, and aggressive, which is non-therapeutic. Option 4 is incorrect because it indicates passivity on the nurse's part and uses rationalization to avoid the therapeutic nursing intervention. Test-taking strategy: use the process of elimination and therapeutic communication techniques to answer the question. Also, focus on the subject, provide appropriate nursing care. Review assessment of a client who is a substance abuser if you had difficulty with this question. 71. The client says to the nurse, "I'm going to die, and I wish my family would stop hoping for a cure. I get so angry when they carry on like this. After all, I'm the one who's dying." The therapeutic response by the nurse is: A. Have you shared your feelings with your family? B. I think we should talk more about your anger with your family. C. You're feeling angry that your family continues to hope for you to be cured? D. Well, it sounds like you're being pretty pessimistic. After all, years ago, people died of pneumonia. The answer is C. You're feeling angry that your family continues to hope for you to be cured? Restating is the therapeutic communication technique in which the nurse repeats what the client says to show understanding and to review what was said. Option 3 uses the therapeutic technique of restating. In option 1, the nurse is attempting to assess the client's ability to discuss feelings openly with family members. In option 2, the nurse attempts to use focusing, but the attempt to discuss central issues is premature. In option 4, the nurse makes a judgment and is non-therapeutic in the one-to-one relationship. Test-taking strategy: use therapeutic communication techniques to answer the question. Option 3 is the only option that identifies the use of a therapeutic technique and focuses on the client's feelings. Review these techniques if you had difficulty with this question. 72. The nurse employed in a mental health clinic is greeted by a neighbor in a local grocery store. The neighbor says to the nurse, "How is Carol doing?" "She is my best friend and is seen at your clinic every week." The appropriate nursing response is which of the following? A. I cannot discuss any client situation with you. B. If you want to know about Carol, you need to ask her yourself. C. I'm not supposed to discuss this, but because you are my neighbor, I can tell you that she is doing great. D. I'm not supposed to discuss this, but because you are my neighbor, I can tell you that she really has some problems. The answer is A. I cannot discuss any client situation with you. A nurse is required to maintain confidentiality regarding the client and a client's care. Confidentiality is basic to the therapeutic relationship and is a client's right. The most appropriate response to the neighbor is option 1. Option 2 is a rather blunt statement and does not acknowledge the issue that the nurse cannot reveal if the named person is or was a client. Options 3 and 4 identify statements that do not maintain client confidentiality. Option 1 is the most direct and correct. Test-taking strategy: focus on the subject of the question, maintaining confidentiality. This should assist you easily in eliminating options 3 and 4. From the remaining options, select option 1 over option 2 because it is the most direct and correct. Option 2 is a rather blunt and rude statement. Review confidentiality issues if you had difficulty with this question. 73. A 39-year-old mother with obsessive-compulsive disorder has become immobilized by her elaborate hand-washing and walking rituals. Nurse Trish recognizes that the basis of OC disorder is often A. Problems with being too conscientious. B. Problems with anger and remorse. C. Feelings of guilt and inadequacy. D. Feeling of unworthiness and hopelessness. The answer is C. Feelings of guilt and inadequacy. Ritualistic behavior seen in this disorder is aimed at controlling guilt and inadequacy by maintaining an absolute set pattern of behavior. 74. Nurse Tina is caring for a client with depression who has not responded to antidepressant medication. The nurse anticipates that what treatment procedure may be prescribed. A. Neuroleptic medication. B. Short-term seclusion. C. Psychosurgery. D. Electroconvulsive therapy. The answer is D. Electroconvulsive therapy. Electroconvulsive therapy is an effective treatment for depression that has not responded to medication. 75. Nurse Perry is aware that language development in autistic child resembles A. Scanning speech. B. Speech lag. C. Shuddering. D. Echolalia. The answer is D. Echolalia. The autistic child repeats sounds or words spoken by others. 76. Nurse Monette recognizes that the focus of environmental milieu therapy is to A. Manipulate the environment to bring about positive changes in behavior. B. Allow the client's freedom to determine whether or not they will be involved in activities. C. Role-play life events to meet individual needs. D. Use natural remedies rather than drugs to control behavior. The answer is A. Manipulate the environment to bring about positive changes in behavior. Environmental milieu therapy aims at having everything in the client's surrounding area toward helping the client. 77. To establish open and trusting relationship with a female client who has been hospitalized with severe anxiety, the nurse in charge should A. Encourage the staff to have frequent interaction with the client. B. Share an activity with the client. C. Give client feedback about behavior. D. Respect client's need for personal space. The answer is D. Respect client's need for personal space. Moving to a client's personal space increases the feeling of threat, which increases anxiety. 78. Nurse Monet is caring for a female client who has suicidal tendency. When accompanying the client to the restroom, Nurse Monet should A. Give her privacy. B. Allow her to urinate. C. Open the window and allow her to get some fresh air. D. Observe her. The answer is D. Observe her. The nurse has a responsibility to observe continuously the acutely suicidal client. The nurse should watch for clues such as communicating suicidal thoughts and messages, hoarding medications, and talking about death. 79. Nurse Trish would expect a child with a diagnosis of reactive attachment disorder to A. Have more positive relation with the father than the mother. B. Cling to mother and cry on separation. C. Be able to develop only superficial relation with the others. D. Have been physically abused. The answer is C. Be able to develop only superficial relation with the others. Children who have experienced attachment difficulties with primary caregiver are not able to trust others and therefore relate superficially. 80. A male client is diagnosed with schizotypal personality disorder. Which signs would this client exhibit during social situation? A. Paranoid thoughts. B. Emotional affect. C. Independence need. D. Aggressive behavior. The answer is A. Paranoid thoughts. Clients with schizotypal personality disorder experience excessive social anxiety that can lead to paranoid thoughts. 81. Mario is complaining to other clients about not being allowed by staff to keep food in his room. Which of the following interventions would be most appropriate? A. Allowing a snack to be kept in his room. B. Reprimanding the client. C. Ignoring the client's behavior. D. Setting limits on the behavior. The answer is D. Setting limits on the behavior. The nurse needs to set limits in the client's manipulative behavior to help the client control dysfunctional behavior. A consistent approach by the staff is necessary to decrease manipulation. 82. Nurse Claire is caring for a client diagnosed with bulimia. The most appropriate initial goal for a client diagnosed with bulimia is A. Encourage to avoid foods. B. Identify anxiety-causing situations. C. Eat only 3 meals a day. D. Avoid shopping plenty of groceries. The answer is B. Identify anxiety-causing situations. Bulimia disorder generally is a maladaptive coping response to stress and underlying issues. The client should identify anxiety-causing situations that stimulate the bulimic behavior and then learn new ways of coping with the anxiety. 83. A male client who is experiencing disordered thinking about food being poisoned is admitted to the mental health unit. The nurse uses which communication technique to encourage the client to eat dinner? A. Focusing on self-disclosure of own food preference. B. Using open-ended question and silence. C. Offering opinion about the need to eat. D. Verbalizing reasons that the client may not choose to eat. The answer is B. Using open-ended question and silence. Open-ended questions and silence are strategies used to encourage clients to discuss their problem in descriptive manner. 84. Marco approached Nurse Trish asking for advice on how to deal with his alcohol addiction. Nurse Trish should tell the client that the only effective treatment for alcoholism is A. Psychotherapy. B. Alcoholics Anonymous, AA. C. Total abstinence. D. Aversion therapy. The answer is C. Total abstinence. Total abstinence is the only effective treatment for alcoholism. 85. When working with a male client suffering phobia about black cats, Nurse Trish should anticipate that a problem for this client would be A. Anxiety when discussing phobia. B. Anger toward the feared object. C. Denying that the phobia exists. D. Distortion of reality when completing daily routines. The answer is A. Anxiety when discussing phobia. Discussion of the feared object triggers an emotional response to the object. 86. Which of the following activities would Nurse Trish recommend to the client who becomes very anxious when thoughts of suicide occur? A. Using exercise bicycle. B. Meditating. C. Watching TV. D. Reading comics. The answer is A. Using exercise bicycle. Using exercise bicycle is appropriate for the client who becomes very anxious when thoughts of suicidal occur. 87. Which of the following liquids would Nurse Lang administer to a female client who is intoxicated with phencyclidine, PCP, to hasten excretion of the chemical? A. Shake. B. B.T. C. Cranberry juice. D. Grape juice. The answer is C. Cranberry juice. An acid environment aids in the excretion of PCP. The nurse will definitely give the client with PCP intoxication cranberry juice to acidify the urine to a pH of 5.5 and accelerate excretion. 88. When developing a plan of care for a female client with acute stress disorder who lost her sister in a car accident, which of the following would the nurse expect to initiate? A. Facilitating progressive review of the accident and its consequences. B. Postponing discussion of the accident until the client brings it up. C. Telling the client to avoid details of the accident. D. Helping the client to evaluate her sister's behavior. The answer is A. Facilitating progressive review of the accident and its consequences. The nurse would facilitate progressive review of the accident and its consequence to help the client integrate feelings and memories and to begin the grieving process. 89. Jose is diagnosed with amphetamine psychosis and was admitted in the emergency room. Nurse Ronald would most likely prepare to administer which of the following medication? A. Equilibrium. B. Valium. C. Ativan. D. Haldol. The answer is D. Haldol. The nurse would prepare to administer an antipsychotic medication, such as Haldol, to a client experiencing amphetamine psychosis to decrease agitation and psychotic symptoms, including delusions, hallucinations, and cognitive impairment. 90. When assessing a male client for suicidal risk, which of the following methods of suicide would the nurse identify as most lethal? A. Wrist cutting. B. Head banging. C. Use of gun. D. Aspirin overdose. The answer is C. Use of gun. A crucial factor is determining the lethality of a method is the amount of time that occurs between initiating the method and the delivery of the lethal impact of the method.